Good day. I am a physician. Vitamin D recommendations for over 60 are outdated. You may have heard that 600 IU of vitamin D is the recommended daily amount after 60. That number comes from research focused almost exclusively on bone health alone. But vitamin D does far more in your body than just protect your bones. Today I explain 2 reasons why 600 IU is almost certainly not enough for most older adults. And I will tell you what the current evidence actually supports instead. This video is for educational purposes only and does not replace professional medical advice from your doctor. Vitamin D3 is not just a vitamin. It functions as a hormone affecting over 200 genes in the body. After 60, skin produces significantly less vitamin D from sunlight than it did in earlier decades. The kidneys, which activate vitamin D, also become less efficient at this conversion with age. These 2 biological changes mean older adults need substantially more input to reach the same blood levels. Number 2. What 600 IU actually does to your blood level? The recommended dose often fails to move blood levels into the range where vitamin D works effectively. The optimal blood level of 25-hydroxyvitamin D for adults is generally cited as 30 to 60 ng/ml. Multiple studies show that 600 IU daily raises blood levels by only 4 to 6 ng/ml on average. If you begin deficient below 20 ng/ml, which is extremely common after 60, 600 IU is inadequate. The Endocrine Society's 2011 clinical guidelines recommended 15 to 2000 IU daily for adults over 70. A 2000 RL update in the Journal of Clinical Endocrinology confirmed that these higher doses are safe and necessary. Research consistently shows that vitamin D insufficiency is associated with increased fall risk and muscle weakness. The VITL trial, a large randomized study of over 25,000 adults, used 2000 IU as the intervention dose. That trial showed significant reductions in cancer mortality and autoimmune disease incidence at 2000 IU. The 600 IU figure was never designed to address immune function, muscle health, or cardiovascular protection. It was set to prevent rickets, a standard that is simply not appropriate for an adult over 60. Number 1. How to find the right dose for your body specifically. There is no universal correct dose per pant, but there is a correct way to find your personal target. The only accurate way to know your vitamin D status is a blood test measuring 25-hydroxyvitamin D levels. Ask your physician for this test. It is inexpensive and widely available. This test is typically covered by most insurance plans and Medicare. If your level is below 30 ng/ml, most physicians and guidelines support supplementing at 2000 IU daily. If you are significantly deficient, your doctor may prescribe a short-term higher loading dose initially. Vitamin D3 is the preferred form. It is more effective than D2 at raising and maintaining blood levels. Take it with a meal containing fat, as vitamin D is fat-soluble and absorbs better with dietary fat. Pair it with vitamin K2 if you are supplementing at higher doses to direct calcium properly to bones. Retest your blood level after 3 to 4 months of supplementation to verify you have reached the target. Most adults over 60 land in a good therapeutic range between 1,500 and 2,000 IU daily with food. This is not aggressive dosing, it is correcting a biological disadvantage that comes with aging itself. By the way, I covered other crucial details on this topic in my full video. The link is on the channel. If this helped you, subscribe, leave a like, and drop your question in the comments below.